Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe heat stroke, its symptom and treatment. Heat stroke is the most serious form of the heat injury and is considered as a medical emergency. Heat stroke can kill or cause damage to the brain and other internal organs. Although heat stroke may affect people over age 50, it also takes a toll on healthy young athletes. The medical definition of heat stroke is a core body temperature greater than 104 Fahrenheit with complication involved the central nervous system that occur after exposure to the high temperature. What are the symptoms of heat stroke? The hallmark symptoms of heat stroke is a core body temperature above 104 Fahrenheit, but fainting may be the first sign. Other symptoms may include throbbing headache, dizziness and lightheadedness, lack of sweating despite the heat, red, hot and dry skin, muscle weaknesses or cramps, nausea and vomiting. Rapid heartbeat, which may be either strong or weak, rapid shallow breathing, behavioral change such as confusion, disorientation, or staggering, seizures and confusion, unconsciousness. What first aid can help heat stroke? While waiting for paramedics to arrive, initiate first aid, move the person to an air-conditioned environment or at least a cool, shady area and remove any unnecessary clothing. If possible, take the person's core body temperature and initiate first aid to cool it 101 to 102 Fahrenheit. If no thermometer are available, don't hesitate to initiate first aid. Do not use ice for older patients, young children, patients with chronic illness, or anyone whose heat stroke occurs without vigorous exercise. Doing so can be dangerous. What are risk factors for heat stroke? Heat stroke is most likely to affect older people who live in apartments or homes that don't have air conditioning or good airflow. Other high-risk groups include people of any age who don't drink enough water, have chronic diseases, or who drink excessive amount of alcohol. Other risk factors associated with heat-related illness include age. Infant and children up to age 4 and adult over age 65 are particularly vulnerable because they adjust to heat more slowly than other people. Health conditions. These includes heart, lung, or kidney disease, obesity, underweight, high blood pressure, diabetes, mental illness, sickle cell trait, alcoholism, sunburn, and any condition that cause fever. Medications. These include antihistamine pill, diet pill, diuretic, sedative, tranquilizer, stimulant, seizures medications, anticonvulsant, heart and blood pressure medications such as a beta blocker and vasoconstrictor, and medication for psychiatric illness such as antidepressant and antipsychotics are associated with the increased risk of heat stroke. What the outlook for heat stroke recovery? After you are recovered from the heat stroke, you will probably be more sensitive to the high temperature during the following weeks. So it's best to avoid hot weather and heavy exercise until your doctor tells you that it's safe to resume your normal activities. Thank you for watching Daily Drug Info.